As you know, tobacco is one of the strong factor which is associated with risk factor associated with cancer. 40% of the cancer in our country are attributable to tobacco use. The single most primary factor which is associated with most of the cancers. There are tobacco related cancers that ranges from 40 to 50%. So the government as well as the non-governmental organizations, they work exclusively on cancer prevention and control strategies. One of the important area of cancer control is tobacco control, and we believe that tobacco control is cancer control. So we started working with cancer control, especially tobacco control, from the year 2002 with the support from World Health Organization and Ministry of Health and Welfare, Government of India. And the government set up 19 tobacco cessation clinics across India. Ours is one of the center which was established in 2002. Later it was renamed as Resource Center for Tobacco Control. We were doing cessation services for the patients and also general public, those who were dependent on tobacco use. And later we realized that working only on tobacco cessation and tobacco control measures, especially working on campaigns, capacity building, does not yield the result that we look for. So we thought we should work more on the other aspect of, like for example, providing alternate livelihood for those who are working in Beedi industry, which is one of the largest industry which produces tons of Beedis in India. There are 7 million women are engaged in this work, and especially in my state, that the state of Tamil Nadu, 7 million women are engaged in rolling Beedi. They don't realize the harmful effects of working in these industries. So it is our responsibility to help them move to alternate healthy, sustainable livelihoods, which will ensure that quality of life, the better quality of life. So what we decided is we went and took a survey, and we wanted to know whether these women are aware of the ill effects of working in this industry. And then we also added a question to understand whether they are willing to shift to alternate livelihood. Surprisingly, although they are not very much aware about the health effects of the working in this industry, but they were willing to shift to alternative livelihood provided if there is a sustainable model. So we took that as a chance. We experimented many options, and finally we found a successful model. I think I'm happy to share with you about the model that we have it with us now. There is you must be aware of FCTC, Framework Convention on Tobacco Control. It's a public health treaty which talks about various tobacco control measures. One of the article, there are many articles, one of the articles which is put forth in the FCTC is Article 17 and 18, which talks about providing viable alternate livelihood for Beedi workers, tobacco workers. Okay, so and also shift the cultivators, the tobacco cultivators, to alternative cropping. So these are the two things which talks about. So we are working in both this area, but right now we are primarily focusing on the first one, that is providing alternate livelihood for those who are working in Beedi industry, which is a smoking form of tobacco. So that is the main objective, which is in line with the global agenda. I think very few people, even very few government works in this line, and I'm happy to share that we are one of the pioneers in doing this work, because we are in the field for more than 10 years now. So we have done a detailed survey and we experimented many projects. One successful model that we brought out is the combining providing care to the cancer patients and help these women to engage in a full-time job. So that's when we associated with Exodus. Exodus is a company which is a producer of wig. So they are a company, they manufacture wigs, and they generously came forward during the time of COVID 2020. Prior we experimented many, like we trained these women on tailoring, we trained these women on coir based handicrafts, but the problem was marketing those products. That was a big challenge. So then we were looking for various options which gives a sustainable outcome, and this wig making is one of the excellent model, I would say, excellent model which is working very effectively. So we already trained more than 1,000 women on tailoring, and we just gave an option to those women who were trained by us that we are planning to set up this wig making unit. Would you be interested? And many said yes, we are interested. And whoever they were willing to work in this, we gave them an option with the monthly stipend of Indian rupees 3,000. And we trained them for 4 to 6 months, and based on their skill and the skill set and their finer activity, and Exodus trained them on making wigs, and then they engaged those women into wig making. Now these women make the quality wig for not only for cancer patients, and also those wigs are sold in the market, and the money that we earn from selling these wigs were given as a salary to these women. So this is the concept. So the first thing is we train these women in wig making, and the women, the wigs made by these women are used for cancer patients, those who are losing hair because of chemotherapy. So that's how it works. One more thing, what is interesting fact is in the wig making industry, getting hair is the biggest challenge. It's very expensive. It is almost equivalent to gold. That's what we realized when we started working on it. It's very expensive. So then we just requested general public to donate hair, and we got an amazing response from youngsters. I know for women, even men, hair is something very important, and it's connected to the beauty. But we got an overwhelming response from public across the country, and they started sending their hairs through couriers, and some of them they come in person, drop the hairs to us. So we collect all these hairs and we give it to Exodus, and they make wigs using those hairs. So that's how it works. That's why I said it's a beautiful model. As you know, cancer and its treatment has its impact on the psychological aspects of patients and their family members. And if you look at some of the impacts are like the distress, body image issues, which is associated quality of life, sometimes not directly with the treatment outcome, but it has some strong association. One of the important aspect during the time of treatment is the alopecia, loss of hair. The chemotherapy has so many side effects. These are reversible side effects. I'm talking about reversible, not the irreversible one. When you talk about reversible side effect, the hair loss is something which is very much concerning for patients, especially the younger women, those who are falling between AYA or middle age group. So alopecia is because they sometimes they even develop depression because they are finding it very difficult to face the society because people around them generally ask. So many a times patients would say that I will stay back here itself because I don't want to go and face the community which I belong to, because people do ask. So it has a strong impact on their quality of life. So that's when one of my colleague who returned from the West said that there it's not a problem. So why not to think about using providing a wig to these patients so that they can cope up well. We debated along because we were unsure whether people in India would accept wigs because it's a cultural implication was there. But when we started doing a survey, we realized that many were aware of the wig and they wanted to have one, but they don't know where to go, and affordability was a big question because they are finding it or they are struggling to pay their bills for their treatment, and also there are a lot of out-of-pocket expenditure already, and if you want to do this and they can't afford to go for one. So that is when we decided to do this project. I think this was down the line 10 years ago, and there was again conducted a survey. We understood the preference of patients about having a wig, and as I said earlier, around 70 to 80% of the patients said if provided free they will go for one. So that's how we started, and we also conducted a small study whether does this help these patients improve their quality of life. It is, and we found out that having a wig at the time of treatment improves quality of life, not global quality of life, especially the body image related concerns. So in a way, for the family and for the patients, this is very helpful. So it's a dual purpose. So one way, the poor women engaged by the industry in beady rolling are now having a life with good quality of life. That's one. And second, public are donating hair, and that goes for a good cause. And the third, those who are diagnosed with cancer, receiving chemotherapy, having issue of alopecia, are getting a wig that improves quality of life. And all the more, now of course we struggle to find a donor, but still some come forward through CSR or some other institutions. They come forward and support us. Though Exodus produce wig, and those wigs need to be purchased because at the minimal cost, that also we need a support. So we spread this message to people around, and they come forward and support us. So all this possible because of the public philanthropy. Otherwise, this may not be possible. What we do right now is only a dot in a circle, because if you look at the data, I was talking only about one state in India. There are many other states where many such women, men are engaged by the industry, the industry, and I think we need to work towards shifting them to a healthy alternatives in their life to have a better quality of life, support them in improving their quality of life and their family, especially children. Sometimes the children also engaged in this work because it's a home-based work. The entire family is involved without realization, and it is continued like a family job. And many a times even the rich women in the village also get engaged because they don't realize that this is harmful. So when we do an awareness, when we tell them that this is harmful to themselves and also affects the other person, majority they say, no, I don't want to continue. So I think we must focus on creating awareness, number one. Number two, many developing nations, especially LMIC, this is a big challenge, especially Asian countries. The smoking form of tobacco, especially Beedi, and similarly smokeless form of tobacco is a big challenge because the cancer associated with these cancers are huge in number. To eradicate, one strategy that we should adopt, I would say universally, is to shift these industry workers to an alternate. Second, we should work on the tobacco cultivators, educate them, create awareness, and motivate them to move to alternative crops, that is crop diversification.